All right, Dr. Susan Bleasdale standing by. We got to get more information on what we're dealing with in the current phase, and Dr. Bleasdale certainly knows more than, frankly, anybody. Medical Director of Infection Prevention and Control at UI Health. Good morning to you.
Good morning. Thanks for having me.
Thanks for coming on. I saw a story yesterday that there's been some significant progress made on what I call the Slurpee. The COVID vaccine, the flu vaccine, a mixture of the both.
The cocktail.
So you don't have to have people get two. I know that's not happening this year, but is that progress real?
It is real. I think it's something that we'll probably have in the future. But, this year it is 2 shots, and it just depends on timing of when the availability of the current vaccine that targets the variants that's out there. But hopefully we'll get that 1 shot once a year in the future.
So explain a little bit, Dr. Bleasdale, the difference. This is a vaccine. This is not like a booster like the ones we've taken before. So explain the difference between this shot and the ones that we've taken in the past.
So this shot that's available right now is directed. It's very similar to what we had to begin with and the boosters. It's really all the same science, which is really helpful, I think, so people don't have to be concerned. It's not something brand new. It's just the same science, the same vaccine directed against the current circulating strains of COVID-19. They have different numbers and letters and acronyms. There's the XBB, which has been the more recent variant, and that this is what the current vaccine is directed against. So it's going to help to protect more effectively for what's currently out in the community.
So we've talked before about how we're going to have to wrap our head around the fact that this is going to be a regular seasonal thing, that you're going to have to deal with COVID. What do you expect now that we're into the fall? Is this going to be a big wave, or is there better controls than we thought that are out there?
Right now we're seeing a lot of increases. We've seen it over the last several weeks. But thankfully, because of vaccination, past immunity, and now with the new vaccine, we shouldn't see the same wave of hospitalizations, and we're not going to see the same wave of deaths. So there's still risk from it for those that are very vulnerable, and so it's important that people that are at high risk for complications really go out and get their vaccine very quickly to be protected. But despite the large numbers, many people probably know someone who's had COVID recently. We're not seeing the same numbers coming into the hospital, and we're not seeing the same numbers of people being so severely sick. So COVID is here, and we're going to see an increase in cases, but it's not going to be to the same degree that we had during the pandemic. It's more like a severe cold.
Well, that's really good news. Having said that, if you could reiterate the importance, if you live with somebody going through chemo, or if you have elderly folks in your house and you have regular contact with them, how it's important to protect them, even though you might think you're fine.
Exactly. So it's really important, those that are very vulnerable, that they get vaccinated, but especially those immune-compromised people that are getting chemotherapy, that have a transplant, that are very vulnerable, that the people around them are up to date with their vaccinations, COVID, influenza, and otherwise, because that helps to cocoon and protect those, again, that are most vulnerable. So really important that those individuals and their close family and friends get vaccinated as well.
Can you get the flu shot and the new COVID vaccine at the same time? And if so, will you expect to feel a little lethargic thereafter, for the rest of the day? Yeah.
Yes. So you can get the COVID-19 vaccine with any other vaccines. It's okay. And it's often best just to get them done all in one time. You're going to feel a little bit weak, maybe a little bit of a fever sometimes. And that's because these vaccines are really highly effective, and that's how your immune system works. It's fighting off the vaccine, which is not a live virus. You can't get sick from it, but your immune system gets turned on, so it's got a memory and a strategy when it gets exposed to the true live virus. So with both, you're going to get maybe a little more aches, a little more rundown, and maybe a low-grade temperature for 1 to 2 days, and then you're going to be better, which is really important because knowing that you're going to feel kind of run down for 1 or 2 days is much better than having severe infection for weeks.
Where is the science on it's the right idea to get them both in the same arm or do them in opposite arms? Where do you fall on that?
Usually they do them in 2 arms. Sometimes if you're getting 3 vaccines at once, you might have 2 in the same arm. But usually, if you're just getting 2 vaccines, 1 in each arm, you're just going to feel a little achy on both sides. It doesn't matter because they're spaced in your arm so that the cells get there and it's going throughout your system and turning on your immune system. So, it just depends.
I think what you're saying, Doc, in medical terms is suck it up, Buttercup.
Yeah, right. Okay,
Much, yeah.
Susan, before we go, I have to ask you, we were at an event, an Illini event together last week, and the hit of the cocktail party, we were talking about shingles, and you had said you had just gotten your shot. I said, wait, I thought that was for over 65. I thought that was an old, I don't want to say older, but, over 65 type shot. And you said, no,
that's okay.
Get your shingle shot.
People over 65 know they're older.
Yeah, whatever, Andre.
Yeah, no, the shingle shot is for the youngins that are 50 and over, so it's indicated at 50 years old. And it's really important that we get it because the new shingles vaccine is really very effective in preventing shingles, which is a recurrence of chickenpox that gets reactivated as we get older when our either just stressors or immune compromise can cause you to get shingles. So getting that at 50 is really important. It's 2 shots. That's another one that's really highly effective that can make you feel run down for a day or 2 afterwards. So just be ready for that. But it's much better than having shingles, which can cause long-term pain for months in some people. So really important to get it.
Last word, and we'll let you actually go and help people because that's your job, Dr. Susan Bleasdale. Is anything at all that you want to make sure people know, since you have the forum, the platform here, what do you want to say this morning?
Well, right now there is the vaccine that's coming out. It's at many pharmacies right now. Health centers are getting it. Really important to get the up-to-date COVID-19 vaccine, especially for those that are over 65 and those that have medical conditions that put them at risk for severe COVID. So get that, get your flu shot, stay up to date with all your vaccines, wash your hands, don't go to work sick, and we'll get through this next increase in cases.
Dr. Susan Bleasdale, again, Medical Director, Infection Prevention and Control at UI Health. She's actually going Halloween. She's going as herself.
Oh, yeah.
Yeah, because it's a cool costume. Because, cool. And you go, oh, you're the infection expert. Thanks for coming on. We appreciate it.
Thanks for having me.
Thanks, Susan. She's great. She's great.
Tom, put her on the list of too smart for the show.